Is this glass half empty or half full? You never can tell, just like being bipolar. I would like to speak to you about my inheritance. As a child, nothing scared me more than being just like my mom. I was more afraid of being like my mom than I was of the boogeyman. Little did I know, the thing that was bothering my mom so much was also lurking in my veins. It's called bipolar disorder. Bipolar is a mental illness that is characterized by periods of mania or going over the top and depression, feeling lower than usual. Bipolar disorder is a hereditary illness. It affects approximately 5.7 million adults, or about 2.7% of the U.S. population of people ages 18 and over, according to the National Institute of Mental Health. Bipolar is a mental disorder that is characterized by periods of mania. And although mania can be described as a rush, the person usually says or does things that they usually wouldn't say or do. Sporadic activities such as promiscuous sexual behavior or erratic spending usually messes up the person's family and gets them in trouble. It affects their livelihood, it affects the person's family, and it puts their life in jeopardy most of the time, some of the time. During low periods, the person is unable to do the normal everyday things that they normally would. Simple tasks such as bathing or going to work, getting dressed, taking care of their kids really becomes a big task. Um, it's always good to have someone that you're accountable to, a family friend, a family member, someone that is understanding and doesn't make you feel bad about your illness. When my mom was manic, she would leave us with family, friends, family members until she got better. But actually, she just felt so good that she needed to get away, needed to do some things, and she would just leave us wherever she left us. The problem was she sometimes forgot where she left us, or time would just be passing and she didn't know where she had left us or how much time had passed. When she was really depressed, she would just stay in the bed, stay under the covers, and me and my older sister would just be left to take care of ourselves. Um, just like with manic, time would pass and she didn't know how much time was passing, which is kind of a bad thing. Um, Bipolar disorder is an illness, just like cancer, just like diabetes, but unlike other medical conditions, people are really worried about going to get help because bipolar is the type of illness that is kind of looked at as being a crazy illness or looked at as being just something that you could get over yourself, or maybe the person's faking. So people don't want to be looked at as crazy or weak, so they rarely go get help. According to a report written from the NDR on 6/10/05, it says approximately one-third of all mental illnesses go untreated. And the sad thing about that is the longer a mental illness goes untreated, the harder it is to treat. And the longer it goes untreated, the worse it gets. Untreated bipolar disorder is commonly associated with substance abuse and dependence, school and work failure, interpersonal dysfunction, and relationship breakdown. Personality dysfunction can be the result of a turbulent clinical course at crucial stages of development. The lifetime risk of suicide is 10 to 15%, and there is an increased risk of violence and homicide, especially with poorly controlled psychotic bipolar disorder. And this is according to this a summary of clinical issues and treatment options written April 1997 by the Subcommittee of Bipolar Disorder. That is horrible because something as simple as bipolar disorder can be treated. Why would you risk your family, your life, your your quality of life, your quality of your family's life, instead of just going to seek out treatment? Like I said, bipolar disorder cannot be cured. It's not something you can cure, but it is something that you could treat. There are a couple of treatment options. You could go to psychotherapy, where you go and sit down and you talk about your problems. You learn to recognize what causes you to become manic, what kind of things trigger your mania, or what kind of things cause you to be depressed, what kinds of things would trigger your depression, and you learn how to work through those. Also, sitting down and talking with a therapist or psychiatrist about your treatment options, about which medication you should be taking, what the side effects or the other medications are, and what would happen if you stop taking your medication. There are several medications that can help you. There used to be a time where all the medications would give you bad side effects. Back in the 60s, they were using electrotherapy, shock therapy, and those things are no longer used except in very severe cases. Medications like lithium are still being used. However, the new generation of medications, they cause less side effects and they are more helpful. Those are things you would need to talk with your psychiatrist about. In conclusion, bipolar disorder is a mental illness that is marked by periods of mania and depression. Unfortunately, this illness is viewed as negative, so many people don't get help. Bipolar disorder is a very treatable illness. Unlike my mom, I decided the best thing I can do for my children is to get help. I sought help and now I am successfully getting treated. Thank you.